India is battling a record-breaking rise in COVID-19 infections that has overwhelmed hospitals and led to severe bed and oxygen shortages. Over 2,200 people have died within a 24-hour period as per the Health Ministry's figure on Friday. The shortage in medical oxygen supply, described as essential by the World Health Organization for COVID-19 treatment, has led to anger amid demands that the central government ensure adequate supply.
दोस्तों नमस्कार। देखिए किस तरह से लोग तड़प रहे हैं। इनका ऑक्सीजन लेवल तकरीबन 40 से 45 के बीच बताया जा रहा है और ये मैडम है और यहाँ पे इनको रोड पे ऑक्सीजन दिया जा रहा है। मैं आपको दिखाऊं, ये देख रहे हैं, ये रोड पे ऑक्सीजन दिया जा रहा है इनको। और भी इन पेशेंट के लोग बैठे हुए हैं और मैं आपको दिखाऊं, यहाँ पे गाड़ी में लोग बिठा के मोबाइल ऑक्सीजन से तहत हेल्प किया जा रहा है। देखिए अब जितने लोग देखेंगे सब ऑक्सीजन के लिए वेट कर रहे हैं।
The country is struggling with a second wave, raising more fear about its overwhelmed healthcare system. A number of people have died while waiting for oxygen, while hospitals are struggling to accommodate breathless patients or even keep alive those who were lucky enough to find a bed.
Very deplorable condition, very unfortunate condition. We probably, we as a doctor, we as a hospital, we are supposed to give life. If we cannot give them oxygen even, what is the situation? When patient comes to, patient will die. Patient will die.
In UP, some hospitals have put oxygen out of stock boards outside, and in Lucknow, hospitals have asked patients to move elsewhere. Smaller hospitals in Delhi are doing the same. A flurry of SOS messages on Twitter and other social media platforms show the severity of the oxygen shortages in states like Maharashtra, Gujarat, Haryana, and MP. In a recent incident, disruption in the supply of medical oxygen killed at least 22 patients in Maharashtra due to an oxygen tanker leaking outside the hospital, halting its supply for about half an hour. In some parts of India, the crisis has led to people stealing oxygen. Desperate relatives in several cities are lining up outside oxygen refilling centers. One plant in the southern city of Hyderabad hired bouncers to manage the crowd. Typically, healthcare facilities consume about 15% of oxygen supply, leaving the rest for industrial use. But amid India's second wave, nearly 90% of the country's oxygen supply, 7,500 metric tons daily, is being diverted for medical use, according to a senior health official. That is nearly 3 times higher than was consumed every day at the peak of the first wave in mid-September last year. Doctors and virologists said the oxygen shortfall was more a symptom than a cause of the crisis. Effective safety protocols and strong public messaging could have kept more people at home and the virus at bay. The government has now started an oxygen express with trains carrying tankers to wherever there is demand, and the Indian Air Force is airlifting oxygen from military bases. They are also mulling plans to import 50,000 metric tons of liquid oxygen. Despite these efforts, a lot will depend on whether the country manages to reduce its daily COVID-19 infections over the course of time. If the chain of infections is not broken by the end of May, India could witness an alarming oxygen crisis, pushing its healthcare system to the brink.